My name's Marc Tressler. I'm an orthopedic surgeon with fellowship training in orthopedic trauma and foot and ankle reconstruction. I've been in practice just over 16 years here in the metro Nashville area. So honestly, my wife convinced me that I should be an orthopedic surgeon. I was an engineer. I was not as happy as I wanted to be with my previous career, and my wife said, you just need to change, and orthopedics would be something that I think you'd like. The most gratifying aspect of my job is being able to touch people's lives in a positive way each and every day that I come to work. Having people know that I care and that I'm not just there as a pass-through for getting to the next patient is meaningful. I think what I enjoy most about my job is really, again, having a positive impact on people's life each and every day. Being able to take someone from sickness to health, from pain to recovery is a very powerful thing. An instance when I make a difference in patients' lives actually is fairly regular. I do total ankle replacements, and that's a procedure where I've done almost 1,000 times, and I still to this day tell people that if you want to see a grown man cry, you replace their painful ankle that's barely able to, they're barely able to use on a daily basis, and give them a pain-free or relatively pain-free joint, and they get on with their lives. It's actually quite remarkable. So a specific thing that I would tell people is don't ignore yourself, don't ignore change in your body and your performance. Most things can be addressed more simply when they're addressed earlier. So many times in this profession, a person will come in and have a really, really bad problem, and you'll say, how long has this been going on? And they'll say years, and you're a little bit perplexed that they waited so long, and when you dive deeper into that, they just simply ignored the problem and thought it was going to go away. So many things are easy to treat. I mean, it's not like we're treating cancer very often in this profession. Occasionally we're confronted with it in orthopedics, but catching any mechanical problem in the body earlier is way easier than waiting until it's an absolute disabling mess. What do I hope to accomplish during my lifetime is to make a positive impact on as many people's lives as I possibly can. I think this profession gives me a great opportunity to help people understand that things can get better. I can be involved in positive change in their life, and I think that is something that makes this profession both different than many, and something that gets me out of bed every day and gets me excited about coming to work. Well, I think that Hughston Clinic's orthopedic practice is different in that we are a regional orthopedic group. We do have 11 offices, I think, in the state of Tennessee, but we have offices in several states, and it gives us the ability to have a larger group of colleagues in different regions that we can bounce ideas off of, we can learn from, we can call at a moment's notice and say, hey, what would you do for this problem or that problem? And it really allows us to be able to advance our technology and our patient care techniques more rapidly than someone else that's in a group that's isolated to just a certain area of the country.